Kenya, we lose more than 1,000 people every year to rabies. So what we are doing as Boehringer Ingelheim is to try and stop the spread of rabies. So the major factor of rabies is the dogs at home. So we are carrying out a vaccination campaign to vaccinate the dogs, because 90% of the rabies cases are spread by dogs.
We run a Stop Rabies campaign where we use the entire ecosystem over here, where our distributor did approach Zipline to deliver the vaccine in remote area. At the same time, we have one of our social entrepreneurs, which is Drop Access. They have cold chain approach. They have the ice box to make sure that we have the vaccine in good conditions and vaccinate as much as we can of dogs.
So Zipline comes in as a partner. We are a logistics company, so we partner with BI to ensure that these vaccines are delivered in time and efficiently to these specific regions they have chosen.
All this process between ordering and packing and launching the drone, it's less than 7 minutes. Our drones can go 400 kilometers one way, and one flight will take 40 to 54 minutes to that county. And you can imagine if farmers were waiting for these vaccines by road to come from the nearest cold chain center or the nearest regional head office, which is in Kisumu, it will have taken maybe 2 to 3 hours by road.
Drop Access is a Kenyan limited company that operates as a social enterprise, and our main aim here is to manufacture cold chain that support the healthcare communities that are based in off-grid places that don't have electricity, but also far off places that face inaccessibility of cold chain for the healthcare sector. Drop Access and Vaxibog has in turn supported the work that Boehringer Ingelheim is doing. So Boehringer Ingelheim has worked with the Zipline to model out how drone deliveries can be done for vaccines. So Vaxibox is going to keep those vaccines within the acceptable temperature range, and ensure they're monitored while they're being delivered to the various vaccination facilities.
At the same time, we have the community support through our partnership with GASP and with Health and Wealth community support over here to make sure that the community understand the issues and challenges related to rabies. At the same time, encourage them to collect dogs, and we vaccinated almost 2,000 dogs.
This is a very important exercise in regard to the community, and with a special emphasis to our people living with albinism, who at one point the dogs in the community were being released to chase them, to bite them, just because they are not human beings. But with this now, there's a lot of visibility.
One thing that we focus on more as a county is we know that public-private partnership is the only way out to address One Health challenges, rabies among them. So as a government, on our own, we cannot really achieve this. And that's why we call on partners. Like right now, we have the partner that has come in to bridge the gap. So when we have partners and we focus on mediating this, filling this gap, it enables us to reach the 70% percentage coverage for the rabies, which is actually required for preventing rabies cases in dogs.